Hey guys, I am back with another lesson. I am Dr. Naisha Bunner, and today we will be going over how to study disease processes and medications. So today's lesson is going to be lengthy. So if you want to print these PowerPoints, if you want to go ahead and get your notebook out, or if you take notes on a tablet, I suggest you take notes because I will be talking not directly from the slides. I will be inserting extra stuff in as well. So even though I picked the disease process and specific medications today, these are fundamental and foundations that you can build your studying on. So today I'm going to actually give you studying mechanisms, and then I'm going to show you how to apply it. So I'm not just the type of tutor or instructor that likes to tell you that you should do something, but I like to show you how to do it yourself. All right, so let's begin. So first we're going to talk about how to break down a disease process. So what is a disease process? Such as like hypertension, asthma, all those different types. You know what disease processes are. So first we're going to start off with the pathophysiology of it. What is happening in the body? You need to refer to your anatomy and physiology notes, okay? Then we're going to discuss your diagnostic procedures. How is this disease diagnosed? Also the lab values that go with it. So as we talked about in the last lesson, it's not good to just know your lab values, but it's way more important to know what the lab values represent, if they're high or if they're low. Risk factors. These are high risk populations. What puts someone at risk for this disease? So as you're going to learn how I work and how I teach, is we always want to know the how and the why. I'm constantly asking, why is this happening, or how could this happen? So those are two good questions to just keep in mind. Clinical manifestations. How does the patient look? So you'll hear me refer as, how does the patient look? That means, what are the signs and symptoms that the patient is presenting? Complications. What are some complications that can arise from this disease if it's not treated? Nursing interventions. What are you going to do as a nurse, and what can you expect the doctors to order? So all these things that I just mentioned will be in a file, so you can download this PDF right here. And this right here is just my favorite. I love this. I used this when I was in school. It was a little different, but I taught from this template right here. And you would put the disease process right in here, and then you would just fill in each thing that we just talked about. The only one that is different is the nursing diagnosis. And the nursing diagnosis is so easy to understand and so easy to get once you understand the pathophysiology behind the actual disease process, right? All right, so today I picked the topic. Well, one of my students picked the topic, and she chose GERD. So we're going to talk about GERD today. So even if you're not talking about GERD in your class, still listen, because this is going to show you how to break down a disease process, okay? So let's go. All right, so what is GERD? GERD is gastroesophageal reflux disease. All right, so let's talk about the patho behind GERD, because a lot of times we know what something is, right? We know what reflux is, but what does reflux actually does to the body? What is happening in the body that makes a patient has reflux, right? All right, so the patho behind it is the lower esophageal sphincter, which is the LES, I'll refer to it later on, is to prevent food from moving back up the esophagus. But if the LES does not remain closed due to, number one, not having enough pressure, or number two, the stomach having more pressure than the LES, which makes it open. All right, so let me find my little, what's this thing called? Little laser, right? So we can talk. So we see the stomach. So this is our stomach, right? This is the stomach. All right, so you see right here, this is the sphincter right here. So this is the LES, right? This is the LES, and even on this side, right? The LES. All right, so you see in the closed sphincter right here, this sphincter is closed, and this is our stomach contents right here. You see how where it's closed right here, guess what? Nothing can come up the esophagus, and this is the esophagus right here. But when it's open, as you can see, it's open. So I call the LSE like a door between our esophagus and our stomach. So if this door is open, the stomach contents that is in our stomach, all the gastric acids and pepsid, which is a stomach acid that serves to digest the proteins, if that sphincter is open, guess what? It flows up the esophagus, right? It goes up the esophagus, which can cause inflammation and irritation, right? So does that make sense? So the biggest thing with GERD is this sphincter, for somewhat reason, is it's too much pressure in the stomach. Either your sphincter is relaxed, that it doesn't have that much pressure, that it is allowing the door between your stomach and your esophagus to open. Does that make sense? All right. So GERD can be diagnosed two ways, and not limited to these two ways, but these are two ways that I'm focusing on, is by having endoscopy, which allows the visualization of the esophageal muscle. So basically a scope just going down to actually look at the muscles in the esophagus, and pH testing to find out if the contents are acidic or not. And we know that stomach contents are acidic, so pH testing could be done. So we're going to talk about populations at risk and risk factors for GERD. So the most important thing when it comes to risk factors is knowing why something is a risk factor and how does it relate to that disease process. Right, so we learned the anatomy and the physiology of GERD. So now let's apply it. So when dealing with this hernia, it is a part of the stomach that pushes into the chest. So this makes the LES, which is the lower esophageal sphincter, relax and not close like it should. So remember, we call the LES the gate between the stomach and the esophagus. That gate needs to be closed in order to prevent stomach contents from coming up the esophagus, right? So you need to have a certain amount of pressure to keep the gate closed, right? All right, so pregnancy. It reduces the pressure of the LES. Obesity. In obesity, you have increased intra-abdominal pressure, which lowers your LES pressure. With medications, each medications can do different things, but 9 times out of 10, they may lower the LES. All right, with drinking, alcohol damages the lining of the esophagus and it relaxes the LES. We do not want to relax LES. If the LES is relaxed, it is not closing as it should. So it can allow continents to move from the stomach to the esophagus. Smoking weakens the LES. Stress. With stress, you have an increase of acid production. With soda and caffeine, these are highly acidic beverages. So guess what? They put stress on the LES, right? So how about our foods that we eat? The foods that we love, right? So our high-fat foods and our fried foods, guess what? They trigger a release of a hormone called CCK, which can cause the LES to relax. So when it comes to patient teaching, your patient may want to know, hey, why can I eat this? Why can I drink this? And you're able to explain it to them. Or when you get on a test and you have to pick out risk factors, you're able to think about the pathophysiology behind why a patient can't have this. You're able to rationalize, okay, a patient is at risk for this because of this. So it gives you the why and the how. I know that was a lot, you guys, but we made it through. Let's continue. So how does the patient look? So this means what are the signs and symptoms that your patient may be complaining of? So they could be complaining of bloating, burping, a sensation of food being stuck in their throat, hiccups, nausea, weight loss, dry cough, heartburn, regurgitation, a chronic sore throat, and hoarseness. So two that I want to talk about is the chronic sore throat and hoarseness. So why would you think a patient would be dealing with respiratory issues with GERD? I'll give you time to think about it. All right. So a patient could be aspirating on stomach contents. So the contents that are in your stomach could be leaking into your lungs. Acid in your lungs over time can cause permanent lung damage. So sore throat and hoarseness can be caused because of the inflammation to the vocal cords from the acid. So this is just going a little step deeper because you understand what is actually happening in GERD. You're then able to understand why certain symptoms a patient is having, right? So complications of GERD. So esophagitis, which is inflammation of the esophagus. Esophageal strictures, GERD, can cause narrowing and scarring over time. Aspiration pneumonia is when gastric contents go into the lung. Nursing interventions. So these are nursing interventions that you would expect to do for patients with GERD. So number one, always assess the amount and the characteristics of emesis, no matter which disease processes you're dealing with. If a patient is putting out anything, whether it be stool, whether it be anything, you want to always urine, you want to look at how much, the characteristics of it. You always just want to assess what's coming out your patient. You want to place suction equipment at the bed if the patient is having problems with respiratory issues like we talked about earlier, or if they are aspirating. You always want to have this stuff readily available at the bedside. You want to maintain the head of the bed elevated, especially while sleeping, to prevent reflux. Studies have shown that it can lessen the chances of reflux happening if the head of the bed is elevated. And if we just think about the anatomy of that, then that makes perfect sense, right? Diet modification teachings. These are the type of things that you need to know because I can guarantee you that they're going to be test questions. Anytime it's about diet modification teachings, you need to know them. So you want to limit fatty foods, chocolate, tomato products, carbonated liquids, fruit juices, citric products, and spicy foods. You want to monitor your intake and output. So you want to know it if your patient is taking in this amount of fluid, but guess what? They're vomiting this amount of fluid. You want to make sure that you're keeping a balance of your patient's intake and output. Also, you want to monitor for signs of dehydration. So, you want to look at skin turgor. You want to look at their skin. You want to just look. You want to look if their mouth is dry. You want to assess them for signs of dehydration, right? So we want to make sure that we're in a equal fluid balance. So we know that a lack of water and other electrolytes can cause reflux because the stomach does not have enough water to make your digestive enzymes. So you want to make sure that your patient is hydrated. If your patient is dealing with so much nausea that they cannot maintain their hydration by mouth, then IV fluids as prescribed. And your doctor may put some electrolytes in it, but you would give that as prescribed, right? All right, so finally, you're going to administer medications as prescribed. If they're on any antacids, if they're on proton pump inhibitors, and histamine H2 receptors. And we will talk about those medications in just a few. So let's pause and let's see what all we learned. So NCLEX question number 1. So after dinner time, during your hourly rounding, a patient awakes to report that they feel like food is coming up in the back of their throat and that there is a bitter taste in their mouth, what nursing intervention will you perform next? A, would you perform deep suctioning? B, would you assist the patient into a semi-filus position? C, would you keep the patient NPO? Or D, will you instruct the patient to avoid milk products? So we just said the patient, you're doing your hourly rounding. The patient said they feel like the food is coming back up. What are you going to suggest the patient to do? All right. So we're going to assist the patient to a semi-filus position that could help with that patient experiencing reflux, because we know that being in that upward position, right, can help prevent reflux. All right. So NCLEX question number 2. During a home visit, you are helping a patient develop a list of foods they should avoid due to GERD. Which items in the patient's pantry should be avoided? Select all that apply. All right. So let's read through the options. Hot and spicy pork rinds, peppermint patties, green beans, tomato soup, chocolate fondue, almonds, and oranges. So the answer is going to be A, B, D, E, and G. So one that surprised me was peppermint patties, because I didn't know that peppermint causes the LES to relax. And we know that a LEX that is relaxed is a LEX that is going to allow stomach acid to go up to the esophagus. All right, guys, take a deep breath. We have went over GERD. Woo! Take a deep breath. All right, now we're moving on to part 2 of the presentation, and that is GERD medication review. So I wanted to show you guys how to study a disease process and then how to study the medication. So we're going to go over 3 classes of medications for GERD. Let's go. So I have posted this slide right here on the Facebook page, but this is my cheat code for pharmacology. This is putting it all together so it can make sense for you. So number 1, you need to know what the drug class does to the body. Number 2, you need to learn the drug names in the class. Number 3, who should take the medication? Number 4, know why certain people cannot take this medication. Number 5, how to give the medication, where is the route, the time of the day, etc. Drug and food interactions. No common side effects. Remember that common side effects are predictable even though they are not desirable. So don't get them twisted with your adverse reactions, which those are those things that could very much cause harm to your patient, and the medication then could not actually be being effective at all. How do you try to prevent or lessen side effects? Educate your patient on the medication, how it works, the side effects, how to prevent those side effects, and most importantly, when to call the provider. All right, so this is a drug card right here. I know that you guys may all have drug cards, but I personally believe that having all your information on one sheet, one piece of paper, all together, no front and back, but just having it all on one sheet makes it so much easier to learn, and putting it into your own words makes it so much easier. All right. Let's go. So we're going to talk about antacids. So I put antacid against acids. We got to think of some ways to, creative ways to remember things. All right. So how does this medication work? It neutralizes the stomach acid. All right. It inactivates pepsin and enhances the mucosal protection, but does not coat the ulcer crater. We understand that? So we go back to what is GERD. What is GERD? It is when that stomach acid comes up into the esophagus. So this medication then says, guess what? I'm going to neutralize the acid in the stomach, where the stomach is not going to be as acidic as it is. And then that pepsin that we talk about, guess what? We're going to stop pepsin from even being activated in the body. Right? Okay, let's move on. So antacids, we have your drug names. We have your aluminum hydroxide, calcium carbonate, and your magnesium hydroxide. So who should take this medication? People who have peptic ulcer disease and people who have GERD. Who shouldn't take this medicine? Anyone with a known allergy. So that is your giving for all drugs. If anybody has a known allergy of a medication, we're not going to give it to them. All right, so now let's take a look at the medications in this class. So aluminum hydroxide, calcium carbonate, magnesium hydroxide. So patients who have renal failure bodies do not filter like it should. So there can be an accumulation of magnesium in the body, which is dangerous. It says antacids can disrupt the electrolyte balance of people with chronic kidney disease. So the biggest takeaway is when a drug is being filtered out, if your kidneys are not working properly, your body will hold on to that drug longer than it should. So with some medications, you need to look at the patient's BUN and their creatinine levels. Administration of the medication. It should be taken on a regular schedule. Some are prescribed to be taken 1 and 3 hours after each meal and at bedtime. Several drug reactions, so do not take with other prescribed drugs within 1 to 2 hours of antacids. So let's say you wanted to take another medication that's prescribed to you. At least wait an hour or two before you take that medication after you take your anti-antacid. All right. Tablets should be chewed thoroughly and followed with a glass of water or milk. So let's talk about some side effects. So brands with magnesium may cause diarrhea. Brands with calcium or aluminum may cause constipation. Rarely brands with calcium may cause kidney stones or other problems. If you are taking large amounts of antacids that contain aluminum, you may be at risk for calcium loss, which can lead to weak bones, osteoporosis. All right? So NCLEX question number 1. Which of the following statements describes the action of antacids? Antacids block the production of gastric acid. Antacids enhance the action of acetylcholine. Antacids block dopamine, or antacid neutralizes gastric acid. So D is the correct answer. It neutralizes gastric acid. All right. Next class is histamine 2 receptor antagonists, also known as H2 blockers. So how does this medication work? First, it suppresses your secretion of gastric acid. So guess what? It decreases the amount of gastric acid that is produced in the stomach. It alleviates symptoms of heartburn and assists in preventing complications for peptic ulcer disease. It prevents stress ulcers and reduces the reoccurrence of ulcers. And it promotes healing in patients with GERD. So the drug names that are in this class are the DINES. So that is the way to remember. They all end in DINES. So the first one is cimetidine, famotidine, nicetidine, and ranitidine. So the best way to remember these medications, they end in DINES. So who should take this medication? Patients with GERD, peptic ulcer disease, GI bleeding, and stress ulcer prophylaxis. So side effects for these medications. So even though they're in the same class, they are different medications and they can cause different side effects. So for our famotidine, the most common side effect is headaches. For our cimetidine, side effects are rare, but dizziness, rashes, headaches, and gynecomastia may occur. With our ranitidine, the most common side effect is headache, and with our nicentidine, side effects are rare. So we're going to talk about our cimetidine. This one can be administered orally and through IM injection or IV. Anytime something is administered IM, you need to know your intramuscular injection sites. All right, so food reduces the rate of absorption. So if taken orally with meals, absorption will be slow. So this medicine will take longer to get to working. If it's given IV, it can cause hypotension and dysrhythmias. So if I know that a medication can drop a patient's blood pressure, and I know a medication can cause their heart to start acting funny, I want to make sure that I have a baseline blood pressure. I want to make sure that I'm checking their blood pressure during the infusion, and I want to make sure after the infusion is complete, I want to check their blood pressure. Also, if that patient is not on a heart monitor, I want to call the doctor to get an order, because how are we going to know if the patient is having dysrhythmia if they're not on a heart monitor? All right. So some drug interactions that can happen with cimetidine is antacids. So antacids decrease the absorption of the cimetidine. So you want to make sure that they are administered at least 1 hour apart. And I'm going to skip that one, and then I'm going to the next drug, which is warfarin. Warfarin is an anticoagulant, right? So if they're on a anticoagulant warfarin and they're on cimetidine, it can cause you to be at risk to bleed more easily. So it says that cimetidine and warfarin given together can have an increased anticoagulant effect, which puts you at a risk for bleeding even more. So going back up, so cimetidine passes the blood-brain barrier and the nervous system. So side effects and adverse effects can happen. That's from the central nervous side. So it may cause mental confusion, agitation, psychosis, depression, anxiety, and disorientation. All right. So this one is all for cimetidine, not for the H2 blockers in general, but just for this one medication. Who shouldn't take this medication? Patients with any known allergies, and also it should be used in caution in patients with an impaired renal, which is kidney, or hepatic, which is liver function. All right, so you need to know the renal part, which is your kidneys, right? So that is your BUN and your creatinine lab values. Your hepatic, which is your liver, which is your ALT and your AST. So you want to use it in caution with these patients because it is metabolized by the liver and it is filtered by the kidneys. Okay? So administration of this medication, you want to take them 1 to 2 hours before your antacid, and also smoking decreases the effectiveness of the medication. So you want to tell your patient, hey, you may want to stop smoking because smoking is going to make this medication not work as good as it could. So, NCLEX practice question. So the nurse determines the client needs further instruction on cimetidine if which statements were made. Select all that apply. Number 1, I will take the cimetidine with my meals. Number 2, I'll know the medication is working if my diarrhea stops. Number 3, my episodes of heartburn will decrease if the medication is effective. Number 4, taking the cimetidine with the antacid will increase its effectiveness. 5, I will notify my primary healthcare provider if I become depressed or anxious. 6, some of my blood levels will need to be monitored closely. Give you guys a second. All right, let's go over the answers. All right, so your answers are 1, 2, and 4. I encourage you guys to always read the rationale. That's why with this one, I posted the paragraph rationale, because even if you get the question correct, always read the rationale. Always read the rationale. There is so much information in the rationale. All right, guys, we are almost to the end. Oh my gosh. So, the last class we're going to talk about is our proton pump inhibitors. Right. So, how does this medication work? It suppresses gastric secretion. It is used to treat active ulcer disease, erosive esophagitis, and pathological hypersecretory conditions. Drug name, these are your Zoles. All right? They're Nazoles. So who should take this medication? So we already talked about the first 5 of these, but the last one I want to bring into your knowledge is the treatment of H. pylori. Who shouldn't take this medication? Only thing I could find was those who have known allergies of this medication. They shouldn't take it. So some side effects of your PPIs are headaches, diarrhea, abdominal pain, and nausea. They are at an increased risk for C. diff. So what is C. diff? C. diff happens when there is a disruption of normal healthy bacteria in the colon. So a bacteria then starts to form in the colon. And this patient will have diarrhea, and it is a very distinctive smell. If you ever smell C. diff before, you're going to know when it's C. diff. So they're at risk for C. diff because this medication inhibits gastric acid productions, leading to the proliferation of spores. So remember that your stomach needs to have some gastric acid in there to do what it needs to do. But when you don't have that gastric acid, guess what? Your body can start building up types of bacteria. There are increased risk for osteoporosis related fractures. It says it can alter your intestinal calcium absorption, resulting in an increased rate of bone loss. So remember, calcium, bones, bone loss, fractures. How to administer this medication? You want to take it on an empty stomach. It's normally given early in the morning, even before breakfast. So you want to administer PPIs about 1 hour before or 2 hours after administering other oral medications as prescribed. You want to make sure that they swallow this medication whole. Nursing considerations: you want to monitor your liver function tests. We want to monitor our calcium levels, and we also want to be very cautious of the patient's safety, because it can lead to potential fractures. Fractures lead to what? Falls. So safety. It's a little far-fetched, but hey, you never know. This patient could be on this medication long term and then haven't had their calcium level checked in forever, and then realize their calcium is so low. All right, NCLEX question. A client has been taking omeprazole for 4 weeks. The nurse determines that the patient is receiving the optimal intended effect of the medication if the client reports absence of which of the following symptoms? A. Diarrhea. B. Heartburn. C. Flatulence, which is gas. Or D. Constipation. The answer is B. Heartburn. Omeprazole is used for GERD, and heartburn is a sign and symptom of GERD. All right, so this is just a review of the 3 classes of medications that we went through. So our antacids, remember, they neutralize your stomach's acid to relieve short-acting heartburn. Acid control only lasts from 30 to 60 minutes. Your H2 blockers, they reduces the stomach's acidity to lessen the frequency and the severity of the heartburn. That acid control lasts up to 12 hours. Your proton pump inhibitors, they help block excessive acid production to relieve severe heartburn pain. And that acid control lasts up to 3 days. You guys, we made it. We made it through a 35-minute lecture. I hope that you guys have learned how to study your disease processes and then how to study your medications. No, I did not go over every medication that could treat GERD. No, I did not go over every gastrointestinal disease. But this was a foundation to show you how to study. So even if you're not in your GI drugs or your GI drugs yet, this is just a template to show you how you can do this for respiratory diseases, how you can do it for your respiratory drugs. So I really hope that you guys got something out of the lesson today. Do you think that we will make a great fit? Contact me. I would love to be your personal tutor and help you pass nursing school. My information is below, and I look forward to hearing from you guys. This class was a pleasure. I hope you guys learned so much. I learned so much all over again teaching that. This was so fun, but I hope it was so informative to you all. See you guys on the next lesson.